Coronavirus look like this under a microscope. There's a whole family of them, and they cause things like the common cold and other lung infection. The strain of coronavirus that's making news causes the COVID-19 infections. Researchers think it first passed from an animal to a person, but now it's spreading from person to person. And part of the worry is how it spread easily compared to other viruses.
It can cause mild and severe flu-like symptoms. We hear a lot about the numbers of people with COVID-19, and it's important to know that most people diagnosed with COVID-19 are recovering. But in some people, it can cause a much serious illness. According to Center for Disease Control and Prevention, or CDC,
people who have the highest risk of getting sick seem to be the elderly and people of all ages who have underlying medical conditions like asthma, diabetes, heart disease, or obesity.
hospitals are also caring for patients younger than 65 years of age who do not have prior health problems but still getting sick with COVID-19. So the best way to protect yourself is to lower your chance of exposure. The main way the virus is spread is when people cough, sneeze, and talk. It can also remain in the air for several hours. These droplets can be breathed in by a nearby person or land on a nearby surface.
Infected person also might touch his or her mouth or nose and then touch something else like an elevator button or shopping cart. The virus can live on surface for a couple of hours to several days, depending on the type of surface. Healthy people come along, touch those things, touch their faces, and then they can get infected.
The good news is you can do things to protect yourselves by following the safety protocol implemented by the government.
Do wash your hands. Lather up with soap and water and rub for 20 seconds, about the time it takes to sing happy birthday twice. Wash the front and back between your fingers and under your nails. Do wash often before, during, and after preparing food, before eating, after using the bathroom, after blowing your nose, coughing, or sneezing, and after you touch things lots of other people come in contact with. Remember that elevator button and that shopping cart. Do wear your mask. Make sure it covers both your nose and mouth. If you don't have access to a surgical mask, a cloth mask is a good alternative. Do keep a safe distance from people who are not in your household. Staying 6 feet away from somebody is usually far enough to keep you from breathing in germs. Do use hand sanitizer. If you cannot get to a sink with soap and water, make sure the sanitizer is at least 60% alcohol and rub it all over your hands and fingernails for 20 seconds. And then let it dry completely.
Coronavirus may feel like a big scary unknown, but by following the safety protocol, you can cut down your risk of getting sick. So let's help each other. Stay at home, stay safe. Let's end COVID-19 together.